Hi, everyone, whoever was able to join. I would like to thank you for coming to see my presentation and just learning a little bit more about what I am passionate about. So we can go ahead and get started. And I'm just going to share my screen so we can get this presentation started. So here we are. Let's go ahead and get started with this presentation. And we are just going to take a glance into radiology. So yes, this is a project for an honors contract. However, I'm still speaking on a topic that I am genuinely passionate about, which is this field of radiology. So a little bit about myself is that is one of my career aspirations. And yes, I said one. I right now I'm a junior here at North Carolina A&T, and I am majoring biology pre-med. And right now I'm focused on preparing for the MCAT and considering my medical school options. Right now, I would like to be a diagnostic radiologist, and I'm aware that it takes a lot of work, and I'm prepared to move forward with that. I'm prepared to take on anything that it encompasses to achieve being a doctor, a diagnostic radiologist. And one thing about me is that I'm open-minded. I know that I'm saying that I want to be a radiologist here on December 12th, 2023. But I have an open mind. I know that is subject to change. And I also want to work from home. I don't expect to be sitting in my home every single time that I'm on the clock or I am working. But I think that working from home creates a flexible atmosphere and it can be done with being a radiologist. And we can get into that later. And I also want to open my own practice. I am also interested in commercial real estate, as to hence why I said one of my career aspirations. I'm actively doing things and acknowledging opportunities that I have access to at this time that could allow me to become a real estate agent or have my hands in some kind of commercial real estate organization. And being that I have a background interest in medicine, I can combine the two and have the education as a doctor, work as a doctor, manage the building as a commercial real estate agent, and understand the background of that so that I am not lacking in any of those areas. And, we can also franchise and have different locations. But back to this presentation on radiology. I will have a little bit more details about myself. You can get out your phone if you would like to have access to my LinkedIn, and we can just take a quick glance at that. Right now, I like the heading as well. It just gives my divided attention with radiology and real estate investing. And I also am sure to note down my passion for each of these areas while also focusing on how these areas can tie together. I don't recommend to have a long intro or about section on LinkedIn, but I may update that soon. However, that is something that I am broadcasting. And I also work from home at this time, so that is something that goes along with why I have the urge to do so. So now we can get a little bit into the background of radiology. Radiologists primarily work with diagnostics, for example, meaning they can use x-rays or other imaging procedures such as CAT scans, known as computerized tomographies, to take pictures of body parts, and then they use those same pictures to interpret what those images mean, what the indications are. Does anything look unfamiliar? It could be so many different things that are going on inside of an image reading. And sometimes, if you were to look at that image without having any background knowledge of what to look for, you may think that you're looking at a regular image and you may not see what's causing an issue or any inflammation about one of those images. So once a radiologist has used images to arrive at a diagnosis, his or her involvement at least consists of short-term patient interactions regarding diagnostic radiologists in general. And usually they work alone. Being a radiologist also means that you have to be familiar with technology. You have to be prepared for changes. Someone could patent a new machine that could really advance our health system. And you have to be prepared to say, okay, well, we're going to undergo training and we're going to have to learn to use this machine aside from a few other machines so that you can take care of this set of patients. So here at the bottom are some more examples: X-rays, CAT scans, and other imaging modalities. So there are more radiology subspecialties. Um, Another one is interventional radiologists. And interventional radiologists are doctors who diagnose and treat a variety of diseases, including cancer, using minimally invasive procedures. And they can also include alternative treatments to traditional surgery. Um, Something that is commonly recognized is considering cancer patients, how they usually have to go see their radiologist to check up on their progress. And they use chemo immobilization, known as chemo, which is a procedure that injects chemotherapy medicine into the arteries that feed the tumor or a tumor to cut off its blood supply, or radio frequency ablation. And a radio frequency ablation is a procedure using heat made by radio waves to damage the cancerous tissue. So that goal is just to disrupt anything that's growing so it's not persistent. Here in this image on the right, we have a doctor pointing to something that we call an angiography. And this is an x-ray of the arteries and veins to find a blockage or the narrowing of the vessels or any other problems that may be observed from this image. And we can also just tell by looking at this image is kind of 3D. It makes it a little more easier to understand what a doctor is observing. Other procedures include angioplasties. This is in which a doctor puts a small tipped balloon catheter into a blood vessel. Then the balloon is inflated so that it can open up a blocked area inside a vessel, which I personally think that sounds really interesting. I'm sure that it has to be very, very specific in diameter or radius just to understand that you don't want to damage any of these internal structures. I think that is something that's very particular. We also have immobilization, where a doctor puts a substance through a catheter into a blood vessel to stop the blood flow of that vessel. And this can be done to control bleeding. Gastrostomy tubes. These are feeding tubes that go into the stomach. So the gastrointestinal tract, if you can't take food by the mouth. Intravascular ultrasounds are ultrasounds that are used to see inside a blood vessel to find any probable causes. We have also a stent placement, and this is a tiny mesh coil, which is a stent, and it's placed inside of a blood vessel at the site of blockage. So it's like the blockage has already been addressed. They know that a blockage exists. So now they put the stent inside to expand the stent and open up the blockage. There are a few more other approaches, such as a foreign body removal, where a catheter is placed inside of a blood vessel to remove anything that does not belong or can be disrupting the flow. Another one is a needle biopsy. Doctors can put a small needle into almost any part of the body for imaging observations, and they collect that tissue sample, which is the biopsy, and it can give a diagnosis without surgery. Without surgery. So, an example of this procedure is called the needle breast biopsy. And that can be frequently used in breast cancer patients. Another one is the inferior vena cava, which is IVC filters. And this is a large vein located in the abdomen, and the filter catches blood clots that may go into the lungs. So I can kind of make an analysis of a fisherman having his large net to catch a school of fish. Well, this is kind of similar, having that IVC in that area to try to catch all the blood clots so that doesn't disrupt any more blockages that may be going on. Injection of clot dissolving medicines is when a doctor injects those medicines into a tissue, such as plasminogen activators. And this type of medicine actually just dissolves the blood clots, and it allows the blood flow to your limbs, such as arms, legs, and organs in your body, to be increased so that you can have enough oxygen and blood going to each of your important parts of your body overall. Some people may be familiar with this one, the insertion of catheters, where you can put a catheter into a large vein to give chemotherapy medicines, nutrition, or hemodialysis. And people also get catheters before a bone marrow transplant. And as mentioned previously, seeking cancer treatment. Cancer medicine is given directly at the tumor site, is very direct to combat anything such as tumors that are growing rapidly. So now we're on to radiation oncologists. So these types of radiologists meet with patients to discuss treatment options. Radiation oncologists use images a radiologist has already taken and interpreted to determine if radiation therapy is needed. They then meet with the patient to go over the proposed treatment plan. So pretty much the work is already done. All the radiation oncologist has to do is just speak with the patient to see what furthermore is done, like create an approach after observations. More imaging examples includes breast imaging, cardiovascular radiology, chest radiology, emergency radiology, gastrointestinal, genitourinary, head and neck, musculoskeletal, neuroradiology, and pediatric radiology. So just by closely looking at this slide, I want you to just kind of take note of what each of these subsections mean, what is included. And sometimes some of these things can kind of seem like they're overlapping. However, case by case, depending on what is involved, then you would know how to approach it and what it is considered. So now we have reached part 2 of our presentation. At this time, we can go ahead and pause right here. And I would encourage you to even grab a quick snack or drink. And we are going to pause and resume later.